Alright, let's dive into this. Imagine waiting 10 years for a promise to finally come true. How would that feel? Frustrating? Exhausting? That's exactly what Lee County, Georgia, has been through with its new medical center. After a decade of political battles, legal headaches, and bureaucratic inertia, officials are finally breaking ground in 2027. But here's the thing, this isn't just a local news story. It's a case study in how systemic roadblocks can crush community progress, and why fixing rural healthcare feels like pushing a boulder uphill. Let's unpack this. So, first off, why does this medical center matter? On paper, it's a no-brainer, a state-of-the-art facility serving a rural area where access to care is already strained. But here's the twist, Lee County isn't just building a hospital. They're trying to create a regional hub that collaborates with existing providers. That's smart. Instead of competing, they're aiming to complement. But why did that require a 10-year slog? Let's dissect the chaos. The first villain in this story? Georgia's Certificate of Need, CON, laws. These rules are supposed to prevent hospitals from duplicating services unnecessarily. Sounds reasonable, right? But in practice? They're a weaponized tool. Larger health systems use them to block competitors, not because they're wasteful, but because they're threats. A new center in Lee County didn't just face scrutiny, it faced outright sabotage. Competitors fought it in court, arguing it'd hurt their bottom line. Let that sink in. Healthcare access delayed because existing players didn't want to share the pie. What many people don't realize is that CON laws aren't about efficiency, they're about control. And rural communities lose every time. Then there's the operator issue. For years, the project stalled because no one wanted to run the place. Hospitals aren't just buildings, they need management, staff, and expertise. But why would a provider take the risk in a county with limited funding and population? This is where policy meets reality. Without incentives, innovation dies. And yet, in 2024, everything changed. State lawmakers suddenly loosened regulations. Coincidence? I don't think so. This feels like a calculated move to bypass opposition and give projects like Lee County's a lifeline. But here's the deeper question, if it took a legislative overhaul to get here, how many other towns are stuck in purgatory? Now, let's zoom out. This isn't just about one hospital. Rural America is in a healthcare crisis. Clinics are closing, ambulances take hours to arrive, and specialists are a myth. Lee County's fight mirrors a national trend, underinvestment, regulatory capture, and the myth that small towns can figure it out alone. The truth? Systemic change requires attacking problems from all angles, policy, funding, and collaboration. And yet, even when solutions exist, they are delayed by red tape. This raises a darker thought. How many lives were impacted by this decade-long limbo? How many emergencies went untreated? How many families had to drive an hour just for basic care? So, what's next? The 2027 opening is a win, sure. But let's not crown it a victory yet. Building the center is just Act 1. Running it sustainably? That's the real challenge. Will staffing shortages plague it? Will funding dry up? And what happens when the next CON battle erupts? My gut says this, Lee County's story isn't ending here. It's evolving. And maybe, just maybe, this project becomes a blueprint for other towns stuck in the same quagmire. Before we wrap, I'll leave you with this, progress is rarely a straight line. Sometimes it's a decade-long spiral. But if a rural county can outlast bureaucracy, legal battles, and corporate greed, maybe there's hope for the rest of us. What do you think? Is this a win for communities everywhere, or just a blip in an uphill war? Let me know in the comments. Don't forget to like, subscribe, and keep questioning the systems that shape our lives. See you next time.